We are going to be speaking right now with reporter Bob Hennelly about the urgent need to better support our EMTs and a number of other topics that Bob is covering during this pandemic. In his latest piece, Bob writes that for years, the unions that represent EMTs have warned that American emergency medicine system has long been the weakest link in our healthcare system, upon which COVID-19 is now placing unprecedented strain. Bob is with us now to talk about what we need to do to support the people who are risking their lives to go through this crisis. Bob has written for a number of outlets, including The Village Voice. He's been part of Pacifica Radio on WNYC, CBS MoneyWatch, and other outlets. He is a reporter for the Chief Leader covering public unions and the civil service in New York City. Bob, thanks for joining us today.
Thanks for having me.
Right before we started our interview, you said you were concerned that we have been hit by the Trump freight train, and you are concerned that no one is paying attention to another freight train that you would like to bring to our attention. What were you talking about?
I was talking about, in my role as the chief leader, I report in the civil service unions. And for several years now, the nation's EMS unions have been warning that our EMS system, just like our profit-driven healthcare system, is inadequate to deal with a good day, much less an unprecedented pandemic that could take, by some estimates, as many as 200,000 American lives. And so it's important to understand that we have a very fragile EMS system. And one of the problems here is that we are focusing on the hospitals, where indeed that's where the story is. But if you review the literature of 1918, you'll see that this health event is happening outside the hospitals throughout the community. And people who are paramedics, EMTs, understand that to get ahead of this, you need to be present where people are, because they're getting sick and dying where they are, not in the hospital. By fixating entirely on the hospitals, we encourage a continued panic run to the hospitals, which accelerates the circumstance of dysfunction in these places. And so people need to first understand that Congress needs to immediately, according to these union leaders, stand up EMS local supports by creating block grants immediately that will go out the door, because only 11 of our 50 states even require by statute that you have an EMS in your community.
Talk about what the EMS is facing right now, what the workers there are facing in this pandemic.
It depends on where you are. But in the case of New York City and the region, which is the epicenter for this right now, they're facing a situation where, because of the fact that the CDC, the Center for Disease Control, downgraded, and this is very important, the occupational standards and protections for them, because the CDC was worried about liability, they are now going out improperly protected to circumstances where, because of the lack of testing, they have no awareness of what they're going into. And then just by street smarts have to encounter the person who hopefully is still conscious about their immediate history and their distress. And then they, because of the nature of our system, and this is another very important thing, EMS is only compensated for. The whole way this is set up is they only get paid for the run, which they have to do if they're in business, is that they bring someone to the emergency room. This is how all of it is jiggered. So this is exactly the wrong thing to have in place right now. So if you had a conscious president,
did I just hear you right? They only get paid if they bring someone to the emergency room?
Yes, ma'am. If there's anything people take away from this, the most important thing that needs to be done by governors, because they have the competent jurisdiction, is to suspend that requirement.
Wow.
Because civil service and for profit and any other ambulance that derives revenue will only get credit for it and paid in the event that they bring someone to the emergency room. So,
wow. I just read a story in the New York Times about the EMTs, and they didn't mention that underlying economic disaster.
And to varying degrees, hopefully people are making judgment calls. But one of the things that needs to happen is that's an example of how poorly, because remember, this disease, when you're hit by a catastrophic health event, and I have in my life, it hits you like you live. And as you're contemplating that you might die, you reflect on how you've lived. and you've made mistakes and you've structured your life a certain way based on presumptions that all of a sudden, when you're knocking on heaven's door, are totally inaccurate and inadequate for what you were dealing with. That's where we are now. So we have systems set up where EMTs have been hardwired to believe that they can, and the system only works if they only get reimbursed if they bring someone to the ER. That's the reflex. So we need to rethink the whole, according to these experts who are in the field, rethink and triage in place. So we have to have our paramedics and EMTs empowered to, when they find people, make a decision about whether or not to bring them to the ER. This is similarly something that's going on. There are good places where it's being done. In Austin, for instance, they have a very proactive EMS civil servant system. They're municipal employees. Before this happened, God bless them, they had several EMTs embedded in the homeless population. So every day
Well, that's
they
great.
were in touch with the circumstance of these people. So this is how it works. And this is a good example. The city was very enlightened. They called off South by Southwest. And so no doubt tens of thousands of people will be alive because of this, because unlike New Orleans with Mardi Gras, they chose life over commerce. Now, what's further enlightened about Austin is that when the mayor did the right thing and said, hey, we got to close the places of assembly like the library, within short order, the paramedics who are already caring for the underserved and most vulnerable said, oh, Mr. Mayor, by the way, where are the homeless going to go? And
Mhm.
so they rethought that policy and then stood up, and this is the best part, a way to feed these homeless people right now. So that's an example of where a union organized civil service group of people are able to proactively engage. Volunteers can do this too, but people need to understand in this country, much of us are reliant on volunteer EMS.
Yikes. Have you
You know
seen
what I mean
any,
about the freight train?
have you seen any, oh my God, that is quite a freight train. I forgot about the volunteering part. Why would you volunteer if you don't have the proper self-protective gear?
Well, and this is why, for instance, what we need to do is have, and anyone knows Nancy Pelosi or anybody else, they need to stand up. Back during the Clinton administration, they had safe cities, streets, and they provided block grants to police officers, which unfortunately were used for the war on drugs. But the concept is the same. So we need to get out across this country block grants to pay and provide immediately, like battlefield commissions, health insurance and pay for the EMTs that are there. We've already had a problem because of the nature of our economy with volunteers. If you drive around any part of America, and particularly in rural areas, where this is really going to be serious, is where we've closed the rural hospitals. You notice that, right? I mean, we have to look at the last 10 years. We closed rural hospitals. We closed urban hospitals because they weren't making money, right? Now that doesn't seem very smart right now when the fate of our country is going to revolve around the ability to treat people. So that's the whole issue here, is that we have a system that is based on preserving capital and not lives. We have a
So,
system that's about preserving inventory and not using it and not having any redundancy, which is a recipe for extinction in the case of a pandemic.
so you said in your recent or excuse me, your recent piece, America's underpaid, oft forgotten EMTs are bearing the brunt of the pandemic. You said that burnout, injury, and turnover rates are high among EMTs, even among the better paid civil service EMS units who are more common in big cities. As a consequence, the EMTs all end up leaving long before they hit their 6-year tenure mark, which is when peer-reviewed medical studies indicate that patients have better outcomes. So basically what you're saying is, because of the turnover, the people who are coming to your door aren't necessarily as skillful as people who maybe have been on the job for longer,
Well,
and there's good reasons for that.
right, and that's an example of why, and God bless him. I'm in no way trying to cast any aspersions on a brave soul at this point who's willing to go out for as a volunteer. I'm sure there are many volunteers who've done it for many years and are qualified. But there is peer-reviewed science that I've read which indicates that. Imagine this: it's like anything else in our profession. The more you do it, the more skilled you are. And so, particularly when it has to do with applying something like the medical arts, the setting, the environment, the circumstance. What kind of night is it? What kind of people? Who's screaming at you in a foreign language? Which dog is out of control while you're trying to save somebody's life? All of that is something you can't teach in school. So, what's important to understand is, and this is a part of the problem, even our coverage in the media is entirely centric on the doctors and nurses. God love them. But for some reason, I don't know, it's because a lot of EMTs wear blue collars. We don't even imagine who are the people that are getting the patients to the hospital. So that's why we need to think in terms of how this, no more focusing on Donald Trump. We've got to clear the channels and start cross training and doing benchmarking and holding up where it's working, particularly when it comes to field triage and EMT services.
Bob, I want to get to the nitty gritty of what an EMT person does when they come to your house specifically. And I love what you said about they got to deal with the dog that's out of control. They never know what situation they're going into. Uh, what are the other things that they're dealing with right now in terms of the pandemic? From
Right,
doing
right.
some
Well,
research
and
about
it
having,
ranges. I mean, the thing is now in New York City, they're doing between 6,500 and 7,000 calls a day. And so
which
that's
is up from
above,
what? How much more
that's up,
up
say,
from
an
how
average day is 4,000. An average day, and then headed into spring, you might get to 4,500. It dwarfs what was happening on 9/11. So you are going out into the environment, and now you have a situation where you used to be able to use an N95 mask. We've heard so much about these masks. N95s blocks your cavities so that you can communicate, but it does shield you from getting any of these droplets that we've been told about. Those have become rationed. And so you're supposed to use one for each encounter with a patient. Now you're being told to use it. And in some cases, and this is where the CDC betrayed us, um, they're telling you that a surgical mask is fine, or maybe a bandana, whatever because after all, it's an emergency.
maybe a
And so,
coin belt from your belly
right.
dance
And so
days.
I'll give you an example. So what they have to do is you go in, well, first of all, and I've had the privilege of talking to these experts who've done this work. You are looking on the way over to the place, you're getting information from your dispatcher about the nature of the call. As you pull up to the site, you're using your entire sensibilities to examine the surroundings about it, to understand as best you can what's happening in that place. What kind of place is it? What kind of businesses are there? Is it a residence? What's the density of it? Is there, the first thing you look for is exits and entrances in case you find yourself under assault, because as a first responder, you have to think, hey, I could be into a domestic situation where someone just died. And then the entire dynamic pressure of the family is going to come on me as the person coming in. And you're not
Bob,
even in the door yet.
I read a story about EMS who someone did die, and they usually put their arm around that person and try to comfort them. But of course, social distancing requires that they have to stay 6 feet
Right.
away. It must be hard to stay
And
six
so
feet
then
away
you have to
from people
figure
when they're
out
in
when you
their
get
homes
then you
doing
have to have engaged
rescue.
the person if they're capable of being able, they're conscious. You'll engage them in some kind of conversation. Hopefully, you'll have what they call culturally informed. You've heard that phrase, culturally informed. That means you may be able to speak the language if they're an undocumented person. And in New York City, there's about 500,000 folks that are undocumented. Remember, you're encountering someone who may be terrified of anyone in a uniform.
Mhm.
That's another thing. So all of this goes into it, and then you have to do the normal work of assessing what they've eaten, what their actual health circumstance is, and who in the
Bob,
room can help you.
my understanding is also that they are having to make decisions on who gets to go to the hospital and who doesn't. Um, they have to make a decision in that moment on whether this elderly person who's having a heart attack or a stroke or something, that normally would go to the hospital, should be brought to a place where there is a pandemic striking the elderly. They're having to really make these life and death
Well, and that's
decisions.
where that, and a lot of it has to do with the degree to which they have situational awareness, and that's the other problem that we have right now in the country. And this is the problem with the fixation by MSNBC on Trump all the time. I mean, personally, as I've said in another piece, um, I have a piece out on Salon called The Declaration of Interdependence, the
Mm.
Free Republic of Reality. It's more important to hear local governors, Governor Cuomo, Governor Murphy,
I
your
gotta
local
say, I
county
love
executive.
Cuomo these days. My love for
Right.
Cuomo
Well,
has
that's
shot
what
through
you
the
need.
roof.
You need to take instruction and not not engage in what is really, I mean, when I heard this morning, Morning Joe, talking about Florida and how this pandemic might affect the 2020 election and the Electoral College, I just was apoplectic, because what's happening now, it raises very serious questions about the way that we cover news, because it's important for us to relay this information about the actual circumstance that you described. So for EMTs, they need to know, for instance, in real time, which hospitals are still receiving people. They're now standing up systems where, and this is enlightened because it was done in China, where there are COVID hospitals that no longer are going to take general population.
Right.
So again, the idea though is also to, and I'm sure some places are doing it, reduce where you can the run to these hospitals. The other thing to point up is the watering down, and it's so important. The unions right now, people don't really appreciate this, are standing up for the preservation of worker occupational safety and health. And that is now the only thing, because the politicians want people to do things and cut corners. And cut corners is what spreads this pandemic. When you permit the CDC and regulators to say, you don't need the same gauge mask to do this job, then you are making it so that the healthcare sector is spreading the disease. And that's what happened in Northern Italy. And that's what's happening right now.
What are EMT advocates asking for, and how can we support them in their efforts?
Well, it's so myriad, because one of the things is we see there was a great Guardian thing of a young woman EMT in England who was just going about her business, and spontaneously the neighborhood applauded. And there was something for her, like a chocolate cake or something. And then there's also the very tactical thing, because the thing that people are having trouble with is the logistics of running their lives, because the schools are closed. So you have a situation where you could have if you have two parents that are both in the civil service, who's going to care for the child? So, and there's been some effort in local communities, and this is a national shout, right? So your program is national, so it's important people to understand that these civil servants and volunteers may not have a place for their kids, and that's going to hamper their response. The other thing is that there's a need for these folks who've decided to make this commitment to maybe have another place to go to that's neutral, that's not back in their family sphere, because they don't want to bring back the contagion to the family. So if you're someone that has space and accommodation and are in touch with your local EMTs, then you might be able to offer, and there's so many myriad of things. The other thing is to get Congress to immediately address this issue and to help stand up a national EMS corps, and to provide all the people doing this, all the people that are doing this work, volunteer, and in many cases they're making less than $15 an hour, they're making fast food wages. They should be guaranteed health care, and they should be guaranteed.
They don't have health care?
No, in some places they don't. Imagine, this is how bad it is. This is
oh
why.
My God.
Well, I'm just trying to give you the reality on the ground.
I want that, but you got to give me a minute to process the horror.
I understand, but this is the freight train that's upon us. That's what we do, right? We're the situational awareness. We don't care about personalities. The focal point here has to be on this gap. So you can be someone that, if you're one of these, there's some of these fly-by-night proprietarial hospitals, where where what they do is they pay people like $8-9 an hour in some parts of the country. You have no healthcare benefits, and then they charge an exorbitant amount. Those would be the predatory ambulances. Then you have volunteers, wow. people that are volunteering, that are between jobs, that have the skill. There are people that former military who could be retired, and they may have Medicare or Medicaid. But I mean, the other thing we need to do is stand up testing, particularly focused on the healthcare professionals. We need to put an emphasis on making them safe, not out of a hierarchy of a need, but out of self-preservation. Because what we're seeing now is the doctors, nurses, EMTs, and civil servants succumbing to this disease.
Bob, how far down the line do you think it is until we won't? I mean, we might not have enough EMTs right now. Let's just focus on New York City, because well, I know that's your area of expertise, and different places have different things. But, right. They're talking about, as you just said, doctors succumbing to the virus, nurses succumbing to the virus, EMTs succumbing to the virus.
Right.
If there's no EMTs, how's everyone getting to the hospital?
Well, since most people don't even talk about EMTs, I won't miss them, I guess. Where this now is focusing, and this is maudlin, but the big challenge now is to deal with the bodies, quite frankly.
Mm.
And this is a big public health challenge. And so, another case in New York City, I wrote a story about this, maybe 2 years ago, and I don't know if we were talking frequently then, but the city of New York had decided to close two of its satellite morgues, one in Staten Island, the other in Bronx. And so I was doing a story about how the subway workers were telling me that bodies, people that were hit by trains, were being left in their break room for hours at a time because
Ew.
the city. Well, I'm just trying. This is the reality. This is
No,
this is
don't.
what
I want to
people.
hear it, but I still
I
am
understand. So what I'm
shocked.
trying to say to you is right now, with the number of deaths that are happening as we see on television, the question is how to process all of these. And so one of the tactical problems is under New York State law, and this gets into the connection between police. When someone dies at home, until the medical examiner comes and takes the body away, a police officer has to be stationed. Now, on a perfect day when you have full complement of the police force, that's fine. But we now report that we may have as many as 15% of the NYPD sidelined by being quarantined or being sick with coronavirus. So there's so many different ways this works. So now the challenge is going to be of how to properly and respectfully deal with these bodies, particularly when our traditions of burial right and the whole thing how we come to understand this handling this transition is now upended by a public health imperative. That's another freight train that is already upon us that's being worked out in places that are being stressed, like New Orleans.
Here's a question for you, Bob. Do you know anything about whether, and maybe you just mentioned this, but there's a lot of information coming at me quickly. And I also want to give a moment for the people in the stream chat or on Facebook to ask their questions. Do you know if, so the handling of the bodies and a public health emergency, are they aware of, whether dead bodies transmit the virus? Is that why this becomes an emergency, or is it more because there's so many bodies that they just don't have the capacity to deal with them?
Because I'm not a scientist, so I'm not a doctor, and don't play one even on your show. What's important to understand is, so let's go through. I just debriefed one of the shop stewards is what they call a medical legal examiner. That is someone who works for the medical examiner and has the training of a physician's assistant. So just to take you through the granularity of this, a la Law and Order. So someone you love and care for has died in your home. You call someone. They will send eventually, sometimes several hours, maybe even the next day, this individual who is a medical legal examiner. They will look around the room. They will try to determine what's happened, because this could be a great way to hide a homicide, which is why the police officer is there. If they
Nana, you do the shopping. Yeah.
Right, exactly. And so what ends up happening is when this medical legal person comes in, they have to be aware. And this guy told me about a case that happened where the person had been sent home thinking they'd recover, and they died. They were elderly, and they died in the surrounding of their loved ones. It appeared to this person who was experienced, about 20 years on the job, that it was likely everybody in the house had COVID. So as he is, again, like the situational awareness of the EMT with a living person, this professional has to figure out, do I have my personal protection? Because the threat could not just be from dealing with the body, but then the people that are ambient, that are people that are in the room. So those are the kinds of considerations that go into it. I'm still doing reporting on all of this. And again, this virus is not widely understood. The base of knowledge that we are passing to one each other is very limited. Remember when this first started back in December 30th was the first report I saw. And then in January, we were told the collective wisdom was it mainly afflicted older people. And then we learned as it came closer to us that indeed was not true.
What?
Then
I'm just kidding.
Right? Well, and then I know you have to laugh every so often. The other aspect of this is the question of asymptomatic. I saw this happen 4 weeks ago because I get internal documents from the from the fire department. They were telling people who are EMTs, if you are asymptomatic but have been exposed to someone who you know was a COVID case, you are to self-quarantine for 2 weeks.
Right.
Then as the you know what hit the fan, the CDC sends out a, well, you know what? Only if you're symptomatic do you have to worry. You see where we're going here?
Mhm.
Now, I have to say to you, this is a person who covered 9/11. And so we have a certain cynicism in New York City about official communications. I mean, we still remember about the EPA, Christy Todd Whitman, telling us the air was safe to breathe in Lower Manhattan.
Right.
And
Like
I've
it was
interviewed,
still on fire. Yeah.
well, and right. And so it's kind of like that. That's kind of what we're living through in slow motion is a national 9/11 in terms of official guidance. Hey, how do we balance the economy against the reelection efforts of the president? Oh, I don't know. Let's lower the standards. That's where we are.
Yeah. Geez, I can't believe
You
we're
don't
not
want to
talking
call me
about the
again. I guess
EMS. I can't believe we're not talking about the EMS more.
well, and so that's why those of us out here on the left fringe, occasionally we make contributions that should be picked up by the mainstream. Unfortunately, like I say, this fixation is very practical, and so the other thing that we can do in terms of supporting people is please, people, contact your local congressperson and advance the cause of EMTs. Even if in your house, make this something you do today because by raising the profile of this issue, it will do some good. When you see broadcasters going, our very valiant nurses and doctors, when they don't say EMTs, they don't include the people, the vast civil service that are out there. I mean, that's part of the problem is most Americans, when it comes to how the country works, it's like a lazy Susan, my friend. It's kind of like you spin it around, you know the gravy's there, but you have no idea on how it gets in your hand. Not a clue.
Bob,
So, I'm just telling you. I mean, because I'm the guy that goes to the sewage plant and reports on workers. When you
I
turn on the
love that about
faucet,
you.
there's a whole universe of people that make it happen.
Bob, I have another question. I remember when we were on WBAI together, we were talking about EMTs not getting the kind of sort of professional respect that they once did.
Right, right,
That many people who wanted to be doctors would start out as EMTs to kind of get
right.
a sense of the
Back in the
profession,
day, right,
and they would kind of move up, go to medical school,
right,
etc.
right,
Can you talk
exactly.
about what happened, why it's different now?
Well, okay, when this gets into the very unique circumstance of New York City, okay, and that's something that we can kind
It's
of
fine.
unpack a
People
little
love New
bit
York
because
City. They
well,
want to
right,
know.
because back once upon a time, the Health and Hospitals Corporation, which is this huge, I think 11, 12 hospitals, this major system that provides universal health care for everybody. Anybody that's sick can go in there. And then also it's a place for instance, that Bellevue Hospital stopped the Ebola thing. That was the place where you may remember the doctor that came back from being over in Africa. He had Ebola. And while other parts of the country blew it and where their healthcare workers got contaminated, they managed to nurse this doctor back to health. Anyway, back in the day, that used to be EMTs would function out of the health and hospitals. So if you're a working class guy or gal and you love medicine, you don't have a lot of money, you go and you work at there as an EMT, paramedic, work your way up, and you could become, as I say, a medical doctor. And there's a whole generation of them. Well, Rudy Giuliani came in, and the fire department had to
The
drop
Rudy Giuliani, the evil,
mayor. That's right. That's right.
evil,
We
evil.
haven't heard much of him lately. Anyway, he decided because the fire department needed, they were seeing, and this has happened across the country, a decline in structural fires. So there's something we're doing better, right? Buildings don't catch on as fire as much. So the fire department needed something to do, and fire
Right.
departments have a lot of juice. Have you noticed wherever you live, whatever volunteer small town you're in, it seems a volunteer fire department is a key way to get elected to everything. And so key
Well, they're
here is
very
that
good looking. I'm not gonna lie.
well, I guess, and they moved the function of EMTs over to the fire department, and then created a situation where EMTs get like $45,000, but to be a firefighter pays 85,000.
Hmm.
And so it became a way that you, after 2 years, you could transfer to the higher paying with better benefits, with unlimited sick time, um, to a firefighter position. So all the smart boys and girls took their 2 years as EMTs, and by the hundreds, left their jobs as EMTs to become firefighters, thus diminishing the experience of the ambulance people and the paramedics and EMTs. So that's New York City.
Right. That's what we were talking about at the
Right.
beginning.
So they want
Right.
to be elevated. They want to be elevated. And to be quite honest with you, enlightened places, you have to have on Michael McNeil, who leads the Boston PBA EMTs. They have bragging rights because they are paid on the same footing as their fire and police officers. They're very
How did they do
unusual.
that?
Pardon?
How did they do it?
Well, because they organized, and I think Boston was enlightened a little bit, and you see that, and that's a national movement that should happen. We need to have our EMTs raised to the same status as first responders who are police and firefighters. I mean, part of this to understand this is EMTs are relatively new. I mean, in the 1970s, they really got underway. We have what's called the National Fire Administration. That's a federal organization that benchmarks how we respond to fires. We even have a situation where the firefighters have so much juice in this country, both volunteer and paid, that the insurance industry decides on what they're going to charge you for your premium on your fire insurance based on how well your local fire department functions. Can you imagine if we did that with healthcare? How well do your local EMTs keep you alive? Now, that's an example of an economic incentive. See, we got to restructure the whole thing. That's
Bob,
what
I
I'm
have a
telling you.
question. Have you seen under this pandemic, as it spreads to places that are have more volunteer EMS than they do, marginally and poorly paid EMS? Have you seen, the capacity of the disease overwhelming these people? Have you seen there reports of places where you call an ambulance and just doesn't come because there's nobody?
There's in the salon piece that's online now, which I hope you tweet. There is a reference to a very good NBC piece that was done last year. I don't know the name of the author, but it was important because it was exactly that. It talked about how in rural areas that's already a problem. So, and I think it was, what if you call 911 and no one comes, the collapse of America's EMT system. It's in the piece. Great piece of reporting by this reporter. And so what I'm saying to you is that I am trying to collect anecdotal information, but here's the problem. They're in such crisis. It's not like that, oh, who's the PR person that's been assigned to call back Bob?
Yeah, let me talk about this. Right. Bob, it's not a great time for a ride along.
I know.
Well, you can follow Bob's work at Stuck Nation on Twitter, at Stuck Nation. Bob, I hope that you're going to continue to write about this, which I have a feeling that you are. I'm very disturbed by everything that you've just said. And I was already disturbed before you got on here. So, yeah.
I'll also pass along to you. I would like you to get on some of these very enlightened people. The gentleman, the woman that leads the EMT union in Austin. Let me pass along to you these contacts because they make their best case.
Actually, that would be terrific. We'd be happy to have them, but we are also happy to have you. And I look forward to you returning back to us another time. It's nice to see you.
Thank you. Be safe.
Wait, before you leave me, Bob, now that the interview part is over, how's it going in New Jersey?
Are we still live?
You're like up in the cases.
Are we still alive? Are we talking to others in this? Or
we're talking to others in this, but like,
okay, good. I want to know.
The official interview is now complete.
It is. I'm in a place called Neptune, New Jersey, which is a planet away. It's on the Jersey shoreline. It's kind of a working class community. There is. The governor is in New Jersey. Governor Murphy is part of what I think was, as I said in my salon piece, the fact that Governor Cuomo, Murphy, Ned Lamont from Connecticut, Governor Wolf from Pennsylvania pulled together so early was helpful. I think that Governor Murphy is frustrated because we're still seeing in many areas the social distancing not being respected.
Why do you think that is?
Well, I think the fact that the president, and again, we've spoken so much about real stuff, it's okay to have a little bit here at the end as a postscript about the delusion.
Our whole show is about presidential delusion, so that's fine.
Right. But the problem is that the fact that there's not a national standard for lockdown, and there's much smarter people in this calling for this than myself, the fact that you can go on and see in Texas and in Florida, it's kind of like, what's your choice today? Like in Mississippi, you have a governor that's overriding the wisdom of the local elected officials that want to shelter in place. So, as long as there's a buffoon in the White House, everyone's going to think it's a carnival.
Yep. Oh, that's well said. As long as there's a yeah. Oh, I've noticed that the people who are watching right-wing news outlets are still going out and they're fine. And then, now that the president has, I mean, he changes his mind every day. So now that he said, oh, I think maybe we should, keep social distancing for another month. I'm not sure if people have decided, oh, well, now that the president's saying it, maybe we should. I haven't really seen a lot of evidence of that. What I've seen is evidence of me and other progressives and people in cities where we've been hard hit calling loved ones and saying, we're walking around with masks out here. This is coming your way.
I'll give you an example that was very important is that the guidance has been very confused on this. The CDC was saying that only healthy people should not wear masks. And then we had last night I was on MSNBC and I got to give props to this, and I want to make sure to quote this guy exactly. But Dr. Zeke Emanuel was on Lawrence O'Donnell's show. He was a top Obama advisor, and he departed from CDC advice and said, at this point, I think it's prudent for people to wear it, and he had a very good rationale. And so that's the thing. The other thing that's disturbing to me is when I listen to the advice on television, it is entirely weighted towards people that are in their home that don't have to go out to work. So part of the problem here is that because everything's fixated on the president and not on the immediate news of what communities are confronting, people still think that we're doing politics because that's where the conversation is. If we had wall to wall, only frontline people discussing the challenges they face for instance, you should have in constant rotation advice from people about how to self-diagnose. And then you need to have real life accounts of what's happening in your community. And we need to see in the community where people aren't respecting social distancing, and so that we can put social pressure on people to pursue it. I mean, I still think there's a lot of young people out there walking around oblivious to the fact that they could carry it and be totally asymptomatic.
There's that, but there's also old people who've been watching Fox who are like, it's not a problem. And they're walking around, going to their religious services, et cetera, until I called them up and yelled at them that we care about them and please err on the side of caution. Why don't you?
Well, this is a personal service you provide to your extended family.
Exactly. My extended Republican family.
Who you love just the same.
Oh, goodness. Yes, of course. Of course.
Now, how's your family doing, by the way?
My little family, we're holed up in this apartment here in New York City, the same one I was in when we were doing WBAI together.
Right.
It's kind of, I'm an Aquarian, so it's an Aquarian. It's like just from being in the, you're a journalist.
Right.
You kind of are interested in what the hell's going on. So it is a great vantage point if you can leave your house.
Is your husband teaching his college students remotely?
He is, right from this very desk and camera. We
How efficient.
Yeah,
that qualifies you for the new Kia Doro tax credit. Hi, are you using the same desk for 5 different jobs? Why, for you, there's no check and there's nothing on the way.
He was like, where do I do a camera thing? I'm like, right here at my desk. So we were already all kind of set up to do it.
Oh, God bless. Well, I gotta go right more. I'm at home. I'm under, my kids will not have me wandering about. And I will say that there's a little bit of ego death because part of the thing is I'm a reporter. My job is to be out with the people that are covering and putting their life at risk. And this, I have an own mythopoetic in my own brain. And then you realize you put other people at risk because you're a jerk.
Right. But you're here with us, so it's kind of like going out without going out.
Yeah, the thing that I'm really having to work on, and my wife Deborah is helping me with this, is not taking on. I've had some phone calls with people that were absolutely bereft and also very upset and very panicked. And these are people that work in key positions. And so the thing I've been trying to do is learn on how to dial my own anxiety back and be aware of this. I mean, what we're experiencing is without precedent and is going to get profoundly more challenging. and we're going to have to find new ways to support each other that we can't even conceive of right now.
Bob, I found that New York One, which is the New York channel here, if you're watching
Right.
from all over the world, took a sharp left to the pleasant last week. I couldn't put my finger on exactly what day because all the days seem to be running all together for me, but it was sometime around the end of last week.
Right.
They'd be like, the Dow is up by 40, and look, this dog is helping deliver pancakes. They really just stopped like it was kind of nice that it wasn't all fear mongering, but it literally was not enough fear mongering. I mean, they weren't even running the Andrew Cuomo, like at night when you sit down to watch TV after your day is done, turn on the news. They weren't, the place where I get the most information is by watching governors do their
Right.
daily thing. And especially
Right.
Cuomo, he gives you like, they're putting this here. This is how many beds. These are the numbers.
Right.
This is the context for that. The news is all of a sudden very chipper, and they're not reporting, hey, guess what? Your EMTs only get paid by the amount of people they bring to the hospital. And that is a terrible situation, and they're dying too, and they don't have protective equipment, and et cetera, et cetera. What?
Yes, it's all true.
I don't understand why New York One can't be used to kind of drum up a war effort to fight this crisis.
Well, because there's a question of balancing the question of maintaining legitimacy of authority and the continuity of commercial engagement. I mean, that's another thing. Like, we have hardwired us in the idea that, like ideas like, well, let's keep the restaurants running, so let's go out and buy food. I mean, we're not thinking, and we go into these patterns that are pre-wired, and the whole world is different. And so we have to have this ability to, I mean, for instance, the Cuomo press conferences. Of course, I always shudder when our colleagues then have a chance to ask him questions. So I'll give you an example.
Why is that?
Because it's like I know I shuddered. I'm like, this is going to be stupid. Hopefully, it won't be as stupid, and then it is stupid. It's also this missed opportunity. So, and I'll leave you with this. So Governor Cuomo announces that New York City and New York State have this system of private proprietary hospitals that are driven by their bottom line, and municipal hospitals, which are driven by the public interest, and that in this emergency, they need to act as one. And they need to pool their resources and efforts in order to do the best thing by the general population. Now, if I'm a reporter sitting there 6 feet away from the governor and 6 feet away from other reporters, I would say, Governor Cuomo, do you realize that with this ad hoc move, you've just created something called universal care? Something you said was too expensive?
That's
Something Joe Biden says is too expensive?
You're not allowed to go.
So let me get this. We're only going to engage this universal care model every pandemic. Mm-hmm. How about we try it just generally when we're walking around being healthy and unhealthy?
Before a pandemic, for example.
Well, and I know what people are going to say right now, I hear this. Well, in Italy, you hear this line, in Italy, they had public health care. And then I say to them, and so did South Korea. And look how well they're doing. Mm-hmm. You can be a capitalist country, except you have to have the ability, and this will shock people, to have commercial interests be actually subordinate, as Professor Wolf says, to the public interest. And that's where we get lost.
Well,
I got to go write some dismal stuff. See you later.
Yes, please do. We've been speaking with Bob Hennelly. You can find his, you can find him at The Chief Leader, but you can also find him on Twitter at StuckNation. Bob, thanks for being with us today. Appreciate it.